invasive ventilators received from the national government. The county has so far distributed a total of 350,000 masks across the sub-county. Most of the masks are produced in our TVETs in the county, and we target to produce 55,000 masks per week. And this does not only help in giving the masks, but also to reignite economies back in our rural areas. In addition, the county has allocated a total of 250 million for food distribution and cash transfers to the vulnerable members of the community. The county has also given food to those in quarantine at our centers and at their respective homes. And this is given by the fact that those who are on quarantine in their homes and can no longer go to work require to feed. And therefore, the county has been monitoring this to ensure that we support them and we don't force them to go out to look for food or work during their difficult moments. To enhance hand washing, over 500 water tanks were strategically placed in markets, bus parks, and other public areas. And as a county, we want to say beyond the provision of this, I think it is important that the public understands the need to constantly wash, not just wash, but wash within the recommendations given to ensure that we adequately fight this scourge. The county has also decongested bus parks and markets across urban areas in the county in helping to decongest these areas and therefore reduce the risk of spread. Lastly, Waziri, on the area of support, as a county, we have been undertaking the difficult task of taking samples from all these people who are suspects and taking the samples to Nairobi, and it has taken between 3 and 4 days to have some of those samples tested and confirmatory tests given back to us. This is not only inconvenient and costly, but also is an additional risk because these 3 or 4 days where the patient does not know their status, they continue to actively spread the same to others and therefore endangering everybody around us. To this, we also wish to add our request that we need a testing center here in Nakuru, noting that with 2.1 million people and also being a center for many other counties around us, we will need to have a well-equipped and well-manned testing center to reduce the time it takes and also to help us in reducing that infection period when people have to wait. Lastly, I want to take this opportunity to thank the private sector, and just yesterday we received PPEs worth about 3.5 million shillings, and a team that was formed by the national government in response to this, led by James Mwangi of Equity, presented the PPEs that will now be distributed to some of our health workers and also some of our policemen who are in our enforcement team. And to them and many others that have come to our response, we want to say a big thank you to them. We also have received 201 million shillings from the national government, being money meant for fighting COVID-19. These funds will be used to equip our health centers and all our isolation centers. And I want to assure you that one of our biggest principles in this fight against COVID-19 is the safety of our workers. And I want to assure that for the next 3 or 4 months, we have been adequately provided with PPEs, and will ensure that no one has to risk their life for that. Lastly, Waziri, I want to also thank your ministry. There are several government initiatives that are currently going on in the county, not necessarily related to COVID-19, but nevertheless important to the healthcare. We have just visited the radiotherapy center that is under construction at a cost of 500 million shillings. And as I've already mentioned, we have a cancer treatment center here, but we've only been giving radiotherapy because of lack of chemotherapy, because we did not have the radiotherapy center. And through your ministry, the 500 million shillings will go a long way to support our patients who have to travel all the way to Nairobi or Eldoret for these services. Recently also, we made a proposal to the ministry regarding our mental health facility in Gilgil, requesting that you support us so that we can be able to develop the other aspects of the hospital. And I'm happy to note that those issues are already at an advanced stage in their implementation. I want to end by thanking all our healthcare workers, all in the front line, our drivers, our cleaners, our nurses, and to say that today, through the minister, we'll also be recognizing 5 of them who've made commendable effort in their fight for COVID-19. With those few comments, allow me to invite Waziri and indeed to say thank you very much for coming here. God bless you.
Thank you very much, Governor Kinyanjui. Good afternoon, ladies and gentlemen. I'm pleased to be here in Nakuru County to launch the primary healthcare strategic framework and the community health policy. And from the outset, let me also thank the people of Nakuru, led by His Excellency the Governor and the Deputy Governor, for the warm welcome accorded to my entourage from my ministry. For this, I say asante sana. Thank you very much indeed. This visit will accord us an opportunity to assess the level of preparedness put in place by the county government of Nakuru with regard to coronavirus disease pandemic. As you are all aware, I have made several such visits to other counties in the last few weeks to ramp up measures as we seek to curtail the spread of the virus in our country. His Excellency, President Uhuru Kenyatta, in recognizing the danger posed by the disease to our country, directed that all county governments set up at least 300 bed capacity to mitigate the effect of the pandemic. I am informed, as you have just mentioned, Governor Kinyanjui, that the county government of Nakuru has not only attained this figure but has surpassed this target, and I understand now that you are aiming at 1,000 beds over the next 4 to 6 weeks. I want to congratulate you and the people of Nakuru for this preparedness. I am further informed that training of some 551 frontline healthcare workers on COVID-19 is ongoing, and we have just come from where we saw the community volunteer, community health workers who are also being trained here in Nakuru. And once again, congratulations for the community support and using our community and our people so that we can all fight together. Additionally, the county has recruited 68 interns and 98 healthcare workers under the UHC program, while the County Service Board is in the process of recruiting the other, I think, 97 of them. Fellow Kenyans, globally, the primary healthcare approach has been recognized as an effective way of making improvements in healthcare delivery and addressing the heavy burden of disease, therefore contributing to better healthcare, socio-economic development, as well as achieving the universal health coverage. Community empowerment is a key target to the primary healthcare approach that has been adopted for 42 years ago since Alma Ata. This was reaffirmed in Astana, Kazakhstan in 2018 through the Astana Declaration, which Kenya is signatory to. To support implementation of primary health care, the ministry, with the support of county governments and partners, has developed the Primary Health Care Strategic Framework 2019-2024. And I want to recognize here the presence of Yaron Wallman, Chief of Health, here with me from UNICEF Kenya County Office, which has been partnering with us in development of this policy document. And the government is currently working towards 100% community health care units, 100% coverage. And to do so, the ministry has recruited and is training 31,780 community health volunteers. This will ensure full coverage of community health services in the country, which will support the home-based isolation and care for the COVID-19 pandemic and achievement of universal health care. Ladies and gentlemen, the ministry has developed the community health policy, which will lead to better leadership and governance of community health services at both national and county levels. The issues that have been addressed in the policy include recruitment, training, and deployment of community health workforce, as well as a stronger and responsive community health information system. With these policy documents, we intend to invest more in primary health care for sustainable primary health. Even in the midst of our response to COVID-19, the government continues to focus on providing continuous, equitable, accessible, and quality essential healthcare services, which can only be attained through a robust primary healthcare system. The primary healthcare approach requires us to have a whole of society approach to health, which combines multi-sectoral policy and action, empowering people and communities, and integrated health services. This will enable us to focus on health and well-being of individuals and communities, and not just their illnesses. We must therefore emerge from this pandemic stronger by strengthening primary health care in Kenya. Ladies and gentlemen, the launch of the Primary Health Care Strategic Framework and the Community Health Policy demonstrates the government's commitment to revitalize the primary health care systems in Kenya as a critical pillar in the realization of universal health coverage. Fellow Kenyans, I would like to thank the partners who have been working with us to achieve this policy framework and to achieve what we have in terms of not just the COVID-19. As I have repeatedly said, we actually don't have a ministry of COVID-19. We only have a ministry of health. COVID-19 just happens to be one of them, one of the issues we are dealing with. And there lies the reason why I have emphasized today on matters of primary health care. UNICEF has been in the front line of assisting us in doing so. And I want to give a special recognition to Pacifica, Dr. Onyancha, who is here with us because she has been the lead in the ministry as far as discussions on this matter of primary health care is concerned. I want now to turn to the situation in the country as far as COVID-19 is concerned. I have said in the past, and I want to repeat here, that the cessation of movement, the release of people to go wherever they want in the country, was not because we did not expect the COVID positive cases to go up. The President, in his wisdom, with advice from ourselves as the Ministry of Health, decided to do that because we believe that Kenyans have attained a level of care, a level of understanding of this disease, so that it is no longer necessary for the government itself to be the ones following everybody around. You know what you are supposed to do. For me and the ministry, we continue to beg you, we continue to insist that you stay alive. That's our job, is to ask you, please, stay alive. Don't die. Usikufe, tafadhali. Usikufe. We insist that you don't die. And the only way that you don't die is if you follow the protocols that have been very clearly spelled out. Wajua watu walisema wanataka kufunguliwa. Si hata nilisikia waliimba ile wimbo ya Mandela. Freedom is coming. Ikaja on the 6th. Si ikuja 6th. Freedom ilikuja on the 6th. But freedom comes with responsibility. And therefore, this responsibility is now with you and I. And therefore, what happens next is not the question of what the government does, is a question of what you do. It is not the government anymore. Sio serikali, jukumu la kujikinga sasa imebinafsishwa kwa wewe na mimi. That's where it is, that's where it lies. So good people, fellow Kenyans, let's stay alive. Don't die. Today, in the last 24 hours, we carried out 3,895 tests. Out of those tests, 421 have tested positive. Therefore, we now have 11,673 positive cases in the country. And I have often said, these are the cases that we know of. These are the cases that have been recognized because samples have been taken from them. Assume that the next person standing next to you is positive. Hebu muangalie vizuri. Unamuona? Unamuona eh? Ijapokuwa haonyeshi yeye kwamba ni positive, wewe assume that person is positive. And I am not saying that Dr. Rashid Aman is positive, but I am assuming. Therefore, that's why we are keeping the social distance. And he is also assuming that I am also the same. Because kwa hivyo, let's be careful, good people. Because we now have carried out 230,096 tests in the country. From the cases, 409 are Kenyans, while 12 are foreigners. As has been the trend, 297, almost 300 of those are men or male, while 124 are female. And I have noticed, even when you are driving around the country, it is that figure corresponds with the use of masks. The most serious culprits of not using masks are men. The average female walking around this country has got a mask on. But the men are the ones who are the victims of this offense. And I would like to appeal that we adhere strictly to this, to the measures that have been given. The myth also that only old people can get it is also not true. I have said it, and you have sung it. You can get it. I can get it. We can all. There you go. So, age-wise, a 1-year-old infant, has got is positive, and the oldest is a 93-year-old man. In terms of county distribution, Nairobi continues to lead with 6,491 cases, followed by Mombasa with 1,783, and Kiambu at 640 people. Nakuru stands at about number 9 with 155, as the governor said. And out of all these, 42 counties have now recorded positive cases. I would like to appeal to the people of Nakuru to try and keep that number where it is. And I can guarantee you, if everybody is behaving the way I see you now with masks, then it is possible to do so. But don't do it just because the media is here, or because the governor and I are here, and as soon as we leave, unalete hapa kwa chingo. You know there is no nose or mouth. around the neck, so it would help. So just use it the way it's supposed to be used. I'm also delighted to inform you that 570 patients have recovered from this disease. Out of this, 512 have been on home-based care, while 58 are from our various facilities, bringing the total number of recoveries so far to 3,638. In Nakuru County, we have over 30 recoveries so far, with a few, 25 actually undergoing home-based care. And this is likely to be the trend. Home-based care is likely to be the method going forward that we are going to be using. I cannot thank the healthcare workers enough for what they are continuing to do, especially in movement towards the home-based care. Sadly, we have also lost 8 patients today to the disease. Therefore, our fatality is now 217. Our condolences to the families and friends of those who have lost their lives. Finally, I once again want to make a special appeal to the people of Nakuru County to take extra precaution by safeguarding this great county from being ravaged by this pandemic. The only weapon we have at the moment to fight this virus is by observing the containment measures that we have been advising you. Namely, wash your hands with soap and running water, proper wearing of face masks at all times in public places, maintaining of social and physical distance, and avoiding all forms of gatherings. If we just unite and cooperate with the government, this disease will eventually be a thing of the past. We do not have to go through exactly the direction that others have gone through. We don't have to bury people using dozers, as they were doing in New York and elsewhere in Europe. We don't have to go through that. We can avoid it, good people. Kenyans can save each other. And we can all be happy when we hear that the curve has come down. We are not getting the disease anymore. In certain counties, we have already begun to see decreasing numbers every day. And if we uphold these containment measures, it is possible for us just to slip through and not suffer the same way as others have. And the way to do so, when you are in a hospital like this one, in a working environment, please make sure that you're observing the measures. And it is sad that as we open up, people believe that the opening up then is opening up for everything and normal behavior. I don't want to repeat that if we treat this disease normally, what is it going to do? There you go again. We understand, we know it. So when we hear that in factories, particularly in areas like the EPZ, in Nairobi, in factories they are not observing. As they go around their business of making PPEs and so on, factories must ensure that they do not endanger themselves in the course of their work. I have seen people in garages, in street markets, where people are simply not observing this. And I saw it, even on my way, Governor, from Nairobi, as we pass through the various centers, you can see people in markets who are not observing these measures. You are endangering yourselves. Ukienda sokoni, usinunue mboga kwa mama ambaye hana mask. Kwa sababu hiyo mboga, hiyo unanunua, hiyo mboga ni mbaya. Usinunue hiyo mboga. Sana sana kwanza machungwa. Mtu ambaye hana mask, na wewe unanunua machungwa kutoka kwa yeye, utaumbukizwa na hiyo chungwa. Utaumbukizwa na chungwa tu. Kwa hivyo washana na hiyo chungwa. mwambie yeye avae mask. Even the people who are selling vendors, ambaye anakuja kwa gari yako kukuuzia kitu na hana mask, anakuja kukuuzia maji, anakuja kukuuzia kitu kingine kwa matatu na hana mask, unaingia ndani ya matatu ama ndani ya bus, unaingia tu unakaa, unaangalia hapa nyuma yako iko kimtu kingine anakuja na hata naanza whispering to you, na yeye hana mask. Mwambie mimi nikikuangalia wewe naona kifo. Ukimwambia mtu hivyo basi atatoroka, ataenda zake, kwa sababu you don't have to take it. It's a choice. Nobody should force themselves on you without a mask to the extent that they cause you to get the disease. We must cooperate, and that is how we are going to save each other. The healthcare workers, before you save others, save yourselves. Before you save others, save yourselves. Because if you are not safe, then you can't save us. All health workers have been on the front line to fight against this COVID-19, and we appreciate their selfless work as they too are at great risk. Today, thanks to the recognition by the county government of Nakuru, specifically His Excellency the Governor and his team, today we celebrate the following health workers in Nakuru for their exemplary work in the fight against this pandemic. Number one, Dr. Ithondeka Angelina. Angeline? Where is Angeline? You are around, Angeline? Angeline, for those of you who don't know her, is a pediatrician, and for our frontline hospital leadership in COVID-19 preparedness, we recognize your work. She identified hospital champions, and together they led the team in training all the health workers in the hospital. She was key in developing a 6-point hospital plan to cover COVID-19 preparedness. Daktari, congratulations. God will bless you. Number two, Jacob Rotich. Where is Jacob? Jacob Rotich is the county epidemiologist. Jacob established, mentored, and led surveillance teams. He has also led the community response since the beginning of the pandemic. I am told, Jacob, that any case that is suspicious anywhere, when others are running away, you are the one who runs towards the people. Asante sana. Thank you. Makofi kwa yeye. Number three, Sarah Mosop. Sarah is a nursing officer. She has been a change management leader, inspired other health workers to join the team handling COVID-19 cases. She has shown exceptional selflessness in service to humanity. Sarah, thank you and congratulations. Jonathan Orida. Jonathan, where are you? Jonathan is a clinical officer, an influenza surveillance officer. He mentored and led testing services and has been available around the clock to collect samples and train others. He has collected more than 3,000 samples. Jonathan, thank you so much. Asante sana. Joseph Budhia. Joseph Budhia. Joseph Budhia is a driver. He has consistently ferried samples to the National Public Health Lab in Nairobi on daily basis. He is also available beyond normal working hours. Buthia, asante sana, asanteni sana. I just want to congratulate the team and to say that it is not that you are all not working very hard, but we do indeed recognize. Today we recognize this team. Hopefully tomorrow we recognize you as well for the good work that you have continued to do. I know that the governor said that yesterday you got a donation of PPEs, and I would like to confirm, Governor, that we did not also come with nothing. We have come with some 2,000 PPEs for your team, for your healthcare workers, to continue protecting them as much as we can. So I want to once again, nataka kusema asante, and allow for questions, unless, Governor, you have something else to add. Allow for questions from the media, and then do the presentation that we are going to do. But before I do so, let me just introduce one or two people from the Ministry of Health who are with me here. I mentioned Dr. Pacifica Onyancha, but we have also got Dr. Rashid. I saw people waving at you out there, Daktari. Dr. Rashid is, works with me as the CAS in health. We also have the tall man behind him, Dr. Amoth. Dr. Amoth is Acting Director General of Health in the Republic. Dr. Nandiri. Dr. Nandiri is Chief Nursing katika nchi yetu hii ya Kenya. Then there was Dr. Bonamamo. Bonamamo is the one who looks after the samples that are brought by Buthia. Buthia, umewahi kumuona huyu mama huko? Umewahi, mnajuana ni kwa sababu ya kuwa huko mara mingi. Asante sana. Who else is here from health? Dr. Salem. Oh, Dr. Salem. Huyu msi unamjua huyu? You know him from around here. He is the one who comes dealing with primary health care, and he's been with us today as well. We have got another team also who are here with us, but I just wanted you to know that headquarters is not asleep, and we are here to support the county government. Thank you very much indeed.
My name is Miriam Nyambura from Citizen TV. Yesterday, the COG chair by the name Wycliffe Oparanya said that they're actually monitoring the trends in regards to the cases after the reopening of the country. Perhaps what do you have to say in regards to this? Are we doing something that might be regrettable at the end of the day, given that 3,500 cases have been reported since 6th of July? Now, in regards to, there have been concerns in regards to private laboratories actually giving results that have discrepancies. Perhaps what do you have to say about this as a ministry? Are you quite concerned because there's a case in St. Andrew's Turi whereby 17 tested positive, but then 3 days later the results turned negative? What do you have to say in regards to this? And lastly, to Dr. Moth, possibly you could mention or rather tell us about the situation at hand at the Pumwani Maternity Hospital. How far are you in regards to that? Thank you.
Good afternoon. My name is Joseph Openda. I'm reporting for NTV. My questions relate to what the Council of Governors raised, the issues that they raised yesterday. First, Governor Oparanya yesterday said that the counties may be forced to impose a lockdown should the infections surge. Now, is this something that the ministry is concerned about, or is it something that they were considering? Secondly, the focus now is on the counties, but the COG says that they are facing some shortcomings in terms of logistics and capacity. Does this concern the ministry, or how is it going to be handled? Thirdly, we've been seeing that the health workers are also testing positive for COVID-19. Now, this one has an impact because it is reducing the workforce. Is the problem the protective gears, or is it the issue of wrongly using of these PPEs? Okay, thank you.
Well, my name is Alan Ochanda from KTN. Bwana Waziri, you've said that most of the cases in Nakuru that have recovered were actually recorded from home-based care. How far are other counties? How prepared are they? Are all people, is it an applicable law that persons from all cadres of life can actually now take care of their relatives and their friends from their respective homes? And then, Bwana Governor, we've seen some other governors now. Of course, we are not preparing we are not hoping for the best, but it's better to prepare for the worst. And so this is a situation where some governors are now allocating some land for, of course, the burials. Should it now worsen, should the situation worsen? Is Nakuru really prepared? Does it have adequate land in case the situation worsens?
Thank you. Asante sana. I think that Nyambura's question was also the same as Openda's in regards to the opening of the country. First and foremost, as I have repeatedly said, when we were de-escalating the measures that were done, we did it with full knowledge that the figures were going to go up. The question is, how long and for what are you keeping the place locked up completely? The role of the government is to ensure that everybody is aware of what they ought to be doing in order not to get sick. There was pressure. The same people who are here saying whether we made the right decision to open up are the same people who, prior to the 6th, were also telling us we are doing a very bad thing for locking up Nairobi, Mombasa, and the other counties. The same people. You know, the same Musa, the same Musa group. Now, so the issue is that are we noticing anything more than we expected? And the truth is that we are not. This is exactly the modeling that was done. These are the figures that we expected. And we were hoping, just like it is the case today, that we are going to continue seeing a majority, over 90% of the cases being asymptomatic, which then informed the decision of home-based care as much as possible. And as Dr. Amoth is responding to the question that you asked, I will also ask him to touch on the matter of home-based care and how to take care of people when they are at home, and who is allowed to go home and take care of themselves at home. But that is the way to go. Home-based care, for sure, is the way to go. The private labs that have been asked, it is true that there is one lab, specifically Lancet, which is the one that carried out these tests that you are talking about, that eventually turned out negative, from positive to negative. I think it is also the same lab that had also tested another group of people in Nairobi, which also had the same circumstance. The same thing was noticed. So it is not the first time. So what I would like to urge is that if you are hearing from people, I mean, the ministry will take its measures. We have asked our board to review that particular laboratory and see what they come up with. But what I would like to urge is this. If you've been hearing that a lab has got all these unclear results, don't go there. Usiende huko. Why are you going for a test that you know, to a lab that you know has been giving information that may not be clear? I understand that as a government, as a Ministry of Health, we have a responsibility to ensure that the laboratories that we are licensing are those that are carrying out and working in a believable manner. And it is so important for us to keep people informed in such a manner that is true. Because the worst thing that we can do is have a situation where people question the results that we give. So I would like to confirm that yes, we have asked the medical board to look at some of these labs. And where we believe that a laboratory is not performing in accordance to the rules, not adhering to the standards, then definitely we will close them down. But let me ask Dr. Amos to respond to the question that you asked, and then I'll come back to the other ones. Dr. Amos, please.
Thank you, Waziri. Thank you, Excellency Governor. I think I had two questions, one on Pumwani Maternity Hospital, which I visited on Monday, together with my team from the Ministry of Health. And at that time, 290 healthcare workers had been tested for COVID-19, and out of these, 41 tested positive. Of these 41, 19 are frontline healthcare workers, meaning they are doctors, clinical officers, nurses, and laboratory technologists. And then 22 are ancillary or support staff. Of the 41, 2 had been discharged from home from care, and 19 were on home-based care and isolation. And following a meeting with the management of Pumwani Maternity Hospital and Nairobi Metropolitan Services, we agreed that we are going to carry further sensitization of the healthcare workers on proper use of PPEs.
I'm not seeing you.
On proper use of PPEs. Then number 2, we agreed on ramping up of infection prevention control measures, including closure of common areas like the tea rooms, where it was impossible to maintain physical or social distance. We also agreed with the team that we are going to establish an isolation and institutional isolation facility at the School of Nursing for any healthcare worker who tests positive for COVID-19 and does not meet the home-based care criteria for management. We have agreed also with the team, of course, that we are going to give them additional PPEs, and they can also draw down on their share of allocation of PPEs from KEMSA. So as at yesterday and today, the remaining 100 healthcare workers ought to have been tested, and by the end of the day today, we shall have their results, and based on the outcome of the test results, we will be able to institute appropriate management of their cases. Question number 2 was about home-based care. Yes, home-based care by definition is basically management of a sick but a relatively stable patient in a home setting under the supervision of a trained healthcare worker. This was developed by WHO in view of the fact that for COVID-19, a significant proportion of the cases were asymptomatic, and therefore it was quite expensive to maintain them or manage them under institutional care, yet would be able to achieve the same results managing them at home using trained healthcare workers. And we have done a study locally that clearly indicates that it is 9 times cheaper to manage an asymptomatic COVID case at home than manage them in an institutional setting. On average, that cost comes to about 21,300 Kenya shillings. And 65% of that cost is contributed to by simply the materials we have here, the PPEs. So if we can be able to manage you at home, then we can be able to reduce that figure and ensure sustainability as the cases, we have a surge in the number of cases. There's a strict criteria for home-based care. One, of course, you must have a COVID positive diagnosis confirmed by a laboratory and through PCR. Number 2, you must be asymptomatic. Number 3, you must not have any coexisting medical condition, such as high blood pressure, diabetes, or any other chronic medical condition. Number 3, you must have a suitable accommodation, preferably a single separate room at home that is properly ventilated. You must have a caregiver who can be able to provide you with support during this time. There must not be any other family member with a coexisting medical condition or anybody who is more than 60 years, because this group of people are at risk of developing severe COVID-19 disease. And a raft of other measures which are clearly spelled out in the home-based care guidelines, which we have gone further to translate into Kiswahili, and we have discussed with the counties to be able to have an abridged version of ABC of home-based care in local dialect. So home-based care will be applied judiciously and cautiously for a select group of patients who meet that criteria and will be supervised by the trained healthcare workers, including community health volunteers who are being trained in a primary school nearby. So that is the way we are going to go, because 90% of our people are asymptomatic, and therefore will be able to derive a lot of benefit by practicing home-based care. And this is something that we have done before in the era of HIV pandemic, and we believe we can do it this time also. Thank you.
Thank you very much. I think the other issue was the issue of capacity, whether we believe that the counties have capacity. I've just read about Nakuru. You've just heard what the governor has said about this particular county. And I think that let's not beat ourselves too hard. And I think that we should really visit the counties a little bit more than we are, particularly members of the Fourth Estate, because almost every county now, today, in Kenya, has more capacity for care than Kenya as a country had. You know, barely 4 months ago, every county has a higher capacity than Kenya had in terms of infectious disease care, you know, when we started this journey. So I think it is fair. It's fair to recognize the effort that has been put in by the counties. When you talk about isolation facilities, of 1,000 people in a county like this one, they have got ventilators. Thank God that at the moment, from the report that we got when we went there to the isolation facility, thank God that the people are getting better. Nobody is here in Nakuru is on a ventilator. They are being given oxygen as they require. We have got oxygen. A lot of counties did not even have oxygen at the time that we launched this care. So I think it is important, even as we ask ourselves questions, let's also be positive about what has happened and the work that has been put in. It is good for us to have a positive spirit and to encourage the counties to continue this hard work of preparing. And I think that if we do that, then what Governor Oparanya was saying may not come to be. But let us make it clear that the escalation or de-escalation of measures is purely dependent on the behavior of Kenyans. It is not the government that we want to lock down. It is because people will not be behaving that we will have to force a lockdown. So whether we lock down or not is purely depends on you and I. What we do is what is going to inform that decision, because that is the reason why numbers will increase or the curve will slowly begin to even out. So I just want to mention that and to congratulate the county government of Nakuru and the others for the hard work that you continue to do. Governor, we appreciate what you are doing. We have seen the facilities, and please let's encourage you to continue doing so. We realize that Nakuru may cater not just for the residents of this county, but even some of the counties neighboring you. But we think, I have seen, we believe you have got a capacity and capability. So let Nakuru go on and be the shining star that you are clearly developing here. Over to you, Governor, for the other matters regarding if things got worse.
I think, Oziri, before I mention what happens thereafter, allow me just to say that post-6, after some of the restrictions were relaxed, we identify with the statement by the COG chairperson that indeed Kenyans have tended to go back to default setting and as if life is back to normal. And I think this is a very worrying trend. Oziri, I want to assure you, between 6th and today, our numbers have actually doubled. And that continues to be a major concern to us. And over the weekend, I was just looking at the traffic on our main highway, and we had a total traffic jam from Naivasha all the way up. So again, we are seeing what you may call non-essential travel, things that really you didn't have to do. And I think, as we all say, it is really back to us and our personal decisions and the choices that we make. So we want to call upon the public and also the PSV to ensure that they go by the restrictions given by the government, and also to ensure that the social distancing is kept. Noting that many of our public service vehicles, if it's a 14-seater, is supposed to have 7, but that has not been happening. So again, even as we ask the government whether there will be another lockdown or not, that question can only be answered by us. The government cannot answer that question. If we don't behave well, if we continue to disregard all the regulations, then they have no choice but to take us there. Then on the issue of home-based care, I think it's important, like I said earlier, that we escalate our training. Now we are dealing with our community health workers, but I think the next phase for the county is to ensure even you at your own private citizen level, you have the basic skills, because the time when probably your loved one is diagnosed, you have no time to go and get trained. And therefore, we'll be coming up with manuals based on the Ministry of Health training and recommendations to ensure that our citizens have the basic training on what it would take to take care for a loved one without risking their life. And finally, when all that is failed, I think the question was whether we are managing our public cemetery thing. But the reality is that public health includes this last function. And I think as a county, we are alive to this fact. And whether through COVID or whatever other eventuality, the reality is that the county is well equipped. But of course, we hope we never get to this. So we want to focus on the prevention, and even those who get, how we cannot cross-infect the others. But assuming we got to this, I think we will also have a protocol on how to deal with some of these situations. Thank you, and once again, we appreciate your coming to Nakuru Waziri and your team, and for the hard work you're doing for Kenya. I want to assure you history will have very kind words for you. Thank you.
Santeni sana. Thank you very much. I think now we can go to UNICEF. First we deal with okay, Governor, I'm told that I must give you
So the CS is now handing over some PPEs to the governor of Nakuru County. So the CS, the entourage will be launching the primary health care strategic framework and community health policy. So in turn now the governor hands over the policy to the CC Health Nakuru, Dr. Gishuki.